Hello, good morning. You are watching QTV this morning. We are back again. And if you're just tuning in, thank you very much. And I am Ibrahim Abalde. I am with Julden Jai. This is the Thursday edition of your favorite program. So if you're just tuning in, and to our brother Banky in Madrid, Spain, he followed this program a lot. And even last night, he was sending me as to how this program means to them. For those of them that are in Spain and they follow a lot. So it's good to know people are following us outside Julda. Right. Good morning. How are you?
Good morning, Ibrahim. I'm fine. Alhamdulillah. Good morning to our viewers and good morning to my brother. I think this is the first time I'm really sharing a platform with you.
Yes,
oh, really?
Right. Yes, this is the first time.
Oh, now he's
because I think I am only there on that seat when you are not here.
Yes,
right.
Yes. Okay, all right. He's been here a couple of times.
Yeah.
Now Bala is no
he's
more.
Part of, he's no more a guest.
Yes. So Bala, how are you?
I'm fine, alhamdulillah. Good morning to you and also to our viewers.
Yeah.
It's good to be here today on a different seat.
Yes, we will definitely like to go through the through the running order.
Yeah.
We'll take a look at, today there will be no proverb because we have a packed running order.
Right.
And we will do the newspaper review with Bala Musa Kurubali. And of course, ensuring safe medicines, the role of the Medicines Control Agency. We're talking to Tijan Jallo, Director of Operations MCA, and Maria Masimaha, Director of Registration and Evaluation MCA. And of course, we'll also be heat alert, public urge to stay hydrated as temperatures rise. We'll be talking to Lamin M.N. Dabo, Health Communication Officer, Director of Health and Promotion and Education. American medical team set to arrive for free healthcare outreach. Reverend Bidwell Mendy, program coordinator, will be on the program. I think this thing happens annually.
Right.
And every year we invite Reverend on this program to tell us what are some of the itinerary of this, health outreach. Yeah, so Julde, we'll head straight to some of the papers and I'll allow you to take us through
the newspapers.
Yeah, so what do we have there?
Ibrahim, we have the Foroya Standard as well as the Observer 2024, but we will start with the Foroya newspaper, and the main headline on the Foroya is 150,000 jobs promised, but weak tracking systems leave government without answers. That's quite an interesting one.
It is, because when you look at all the promises, government will say, oh, we're going to create 100,000 jobs, 50,000 jobs. But that all boils down to how are those jobs created. Whether they are created or not, how do you know? There have to be systems in place to be able to track that. That is why when you look at the way things are going globally, everything is going towards digital. We are digitalizing everything. Digitalization process is ongoing. But Gambia should not be left behind, absolutely. So all these things, we see new companies coming in. We see in terms of job creation, one will not say it is not happening. It is happening, but to what scale, you can tell. Because there is no system in place that will be able to, look at these things to say, okay, in this sector, in agriculture, we've been able to create 5,000 jobs. In maybe in engineering, this is what we've been able to create. So we see all these things happening, but there is no system that tracks these things to be able to give the actual figures in terms of job and job creation.
Well, recently we've seen the digitalization of certain things in government.
Especially GRA,
yes,
right?
They're trying, because I saw it on the papers. I guess we'll go through that.
So as time goes on, I think we will get there. We will get to a level whereby we will be able to track and know, okay, this so number of jobs have been created. So as to track. But it's important, like you mentioned.
No, but sometimes you hear the government will come and say, we've created this number of jobs. Okay, maybe they have a system that is in place that maybe we are not aware of. But that system also, like I said, I'm not sure it captures all sectors. I'm not sure it captures all sectors. They will usually, all we'll hear is we've created 10,000 jobs. And then people will always come and say, how? You know, there is no data to show that, you know, and all that. Because when you look at some of these surveys that are done, you always see employment rate low, this and that and that. And the government, most of it will come and debunk it to say, no, they've created so much jobs, you know, in this sector, in that sector. But the figures are not there.
And it should be justifiable.
Absolutely.
Right.
At some point.
It should be justifiable. I mean, this was a campaign promise, right?
Yes,
in
it was.
2021.
And I think I've heard a couple of times the Minister of Information will say they've created this number of jobs. You know, they've created so much. You know, he wouldn't be specific because, like I said, the data is not there to support it.
And if you make such claims, it's important for people to, and now people will fact check you, right?
Absolutely.
Whatever claims you make, people will fact check it. So it's important to come up with data that is really specific. But the issue of the job has been made, like the promise has been made since 2021, and it was a campaign promise.
The 150,000 jobs.
Right. So 5 years down the line, we're still coming and then hearing the issue of tracking systems, weak tracking systems. I mean, for me, I believe that, you know, stakeholders or politicians should not just make promises just like that. You don't make promises when you don't have the necessary infrastructure in place. Before you make promises, it's important to actually ensure that all the necessary infrastructure is in place before you, to enable you to effectively implement those promises that you made. So yeah, I mean, job creation, it's something that, you know, one would say that, okay, it's very easy because we've seen the Gambia is the agricultural sector. A lot of people are now, you know, venturing in the agricultural space, but also the fisheries sector. The World Bank report says that the River Gambia has been underutilized. There is a lot that can be done as far as that is concerned. We've seen countries like, you know, European countries, we've seen China, we've seen Senegal coming, you know, to fish in the Gambian waters and all of that. Gambia can do a lot to actually leverage on the opportunities as far as River Gambia is concerned.
No, you know,
but also our agricultural sector because we have fresh water is readily available. So government, I think this is the right opportunity to tap into these sectors to actually help young people to create jobs.
Like you said, but when you look at it also, I think most of the time these politicians will come and make these promises. And I don't see them as empty promises because every political party have their manifesto.
Right.
So they have all these things outlined and they can tell, okay, in the agricultural sector, in this sector, because these are the plans we have, if these plans are implemented, it will create this and this number of jobs. So those plans are there, I believe. But now, how do you actually tell if the number of people those projects are actually employing? Because, you know, employment, let's look at it in this way. Most of the time in the Gambia, they just take you to be like, you work for a company, you work for somebody. It's different. You opening your own business is an employment. It's self-employment. You know, having your own car, you're doing taxi. So the government creates that enabling environment.
Exactly.
And that is what the minister even said the other day, that not directly creating 150,000 jobs, but for the fact that government was able to create the enabling environment
for these things to happen.
A good example is, you know, like for instance, the rural electrification projects. When you look at, I know someone who was working in the Combos here, had like, was working with someone doing this, it's a metal workshop anyway. They used to do these windows, this fiber thing and all that. So when the electricity got to CRR, there's a village in CRR, he went there, he opened his own workshop, you know. So you see, he has created employment for himself there. And so a lot of people, you know, will do these things.
Let's take a look at the agriculture sector. As a farmer, I mean, maybe you do farming for yourself at the end of the time, even creating that mode of transportation, that smooth road of connecting villages to go and sell your produce. It's all form of making sure the route is smooth for employment. I mean, the government will not be able to give each and every person employment. Like you said, they will create the enabling environment. So I think that's what they are talking about.
A good example is the Sahel. I think I saw it on the news. Was it on on Tuesday or Monday? The Sahel rice farm in, I think is it in Nyomi? In NBR. You know, they are doing this rice production, but you see the way they're doing it, they are not actually selling the rice. What they do is, they do this, I think they cultivate the rice, they sell the seed to the farmers. So when the farmers harvest, then they buy the rice from the farmers and in turn sell it.
Okay.
So you see, so that alone is creating employment in different in different ways. So you look at it from a wider perspective.
So the Gambia appoints special prosecutor to lead TRRC prosecutions. I mean,
yes, I think this is long overdue.
It is.
You know, it is long overdue, and so many things have happened. You know, in the past 22 years, we saw the coming of the TRRC reveal a lot of things. A lot of things were happening in this country that were unknown, you know, to us. This year's TRRC, I mean, came out to reveal all those to us, and also the victims have been, you know, waiting for this for so long. And I think the reparation part is ongoing already.
Yes.
So this is the part that was missing. And the TRRC made so many recommendations, you know, some accepted by the government, some actually not. But I believe those that were accepted, even the junglers, you know, yesterday a journalist asked the minister about the fate of the jungle. He said now the fate of the junglers will be decided by this special
prosecutor.
Yeah. So yes, prosecutor's office is not going to be us now, because you know people were, you know, actually debating as to why they are still free. They're going about. So this special court now, the hybrid court, is going to be the one to decide.
Yeah, I think when it comes to the TRRC matters, the Gambia is really doing well. They are really pushing. Most countries, if you go through their history, when it comes to reparation and prosecution at some point, it takes many, many years before certain things are implemented. Let's take a look at a brighter example, the case of Sierra Leone. I mean, at some point, it took many, many years before, in fact, actions were taken. But for the Gambia, at this time, at this short span, we are able to achieve this. I think it's laudable.
And also, I think it is good to know that these things are, very, you know, to set up things like this are very expensive. Very, very expensive. I think we've gotten support. I've seen, is it from the from ECOWAS, the US, yes, and also the American government. I saw that. You know, it's very expensive to set up these things or to run them. But the fact that it is now here, as prosecutor has been appointed, so we hope to see justice.
Even the reparation is not an easy thing.
Yeah, the reparation, definitely, it's not an easy thing, but that now is ongoing. I've seen, you know, they've set up an office, you know, and they've already started working.
They've appointed the committee.
Already. The office is set up already.
So this, like you all said, it's a laudable initiative. It has not really been an easy one, because the job was really 13 people applied for the position, and ultimately the British national, who is Martin Hackett, actually was appointed to be the special prosecutor for the Gambia. But again, this his office is going to prosecute the crimes of at least 69 individuals that were committed during the regime of former President Yahya Jammeh. But not just that, you did mention about the money. It's expensive.
Absolutely.
So the government of the Gambia, in collaboration with ECOWAS, have already set aside, you know, they earmarked $2.5 million. That is a lot of money, you know, for this his office. But not just that, the law also mandates the special prosecutor's office to set up his own budget and his own team, and we don't know how much that is going to cost. So it
that's
means
the operational cost.
Operational cost. So it means we still need to wait and see what will happen. But he will resume very soon. And let's just see what will happen, and then who are the perpetrators that he is going to start off with, because we know it's going to be really, really interesting.
Absolutely.
Because these are high profile cases that each and everyone is actually eagerly waiting to know the outcome of.
Absolutely. Yeah, so let's move on. The unlawful arrest of Hussein and Ami Bojang, the Attorney General expresses regrets over that.
Yes, that was the same press conference
where he mentioned it yesterday. You know, to be honest, the rearrest of Husseini was unlawful, you know, because Husseini was acquitted and discharged, and the prosecutor, you know, filed in they said an interest that they were going to appeal, and they requested for Husseini and the sister to remain in custody, but the judge granted them bail of 50,000 each, and from there they became free. So there was no need for the rearrest. They could only be arrested when a court, you know, approves or calls for the rearrest of them again. But there was nothing like that. So the minister would not have said anything but other than that.
And
absolutely.
apologize.
And apologize, because the government, you know, to be honest, that move was not a good one at all. Because when we all saw it, we were like, wow, okay, we used to see this here. Why is this happening again? So,
yeah.
you know, and the reason why young people, you know, went out to protest, you know, against the arrest and all that, you know, like I said, civil unrest, most of us will be definitely, you know, against it.
Yes,
but there are certain things when it happen, as citizens, we have to come out to, you know, to say, you know, this is not going to happen. And looking at our experience in the past 22 years, we don't want anything like that to happen again in this country.
Absolutely.
The only thing that will prevent a citizenship, I mean, to return to a dictatorship is when they stand for their rights. I mean, you know, I think it's the right of these individuals to come out and express concern over that.
Exactly.
Because it can happen to any individual, you know, so it's more of a no-go
area. Yeah, when the constitution of the land is being violated, I think it's a responsibility of every citizen to defend it to the latter. And I think that is what young people actually did, that this was really wrong. It was a no-go area, and the government really messed up big time as far as this case was concerned. I mean, you have the tools in place. If you are not satisfied with an outcome of the courts, you can always appeal.
They've appealed already.
Yeah,
to me, they have done that already. Now let them wait for the appeal and still push for his arrest.
Exactly. But
they
as far as, you know, they've been acquitted and discharged, that they are really free. They're allowed to go home. And but again, the young people, man, it's the aftermath of what really happened. The young people protesting and all of that. I always say this. The security sector reform is here, but I think, you know, the security forces should really undergo rigorous training, crowd management, and also conflict resolutions and all. These are very, very important fields that I feel they should be trained on. How to handle crowd, how to manage crowd and all of that. You don't want to escalate, because I feel like all these protests that is really happening, you know, it's escalated because of the reaction and how the police officers or security officers were able to handle the case. Imagine you see a crowd of 50 people, and all of a sudden you decide to fire tear gas at them, or water cannons and all of that. Before you know it, you see a lot of other people coming. So I think the way in which they handle these protests, it's really wrong, and I think they should really take a different approach as far as
I think when it comes to escalation, I will disagree with you there, because when you look at the way from the recent protests, not just this one, all the protests, people will come out and protest against something that they think is wrong, you know, and I think the government is listening, you know, from looking at what is happening, because they always prevent escalation. In Hussaini's case, for instance, the moment people came out to protest and all that, an hour later, he was released. You know, that was the escalation. Because if Hussaini was not released, it was going to, you know, grow into something else. And when you know, you talked about the police and use of tear gas and all that, I even saw water cannon and all that. You know, we see these are things that police do to control crowd. You know, when there is protest or civil unrest. But yeah, they can do better. And the security sector reform is still ongoing. That's what a lot of people don't understand. It's not like it has concluded. The security sector reform is still ongoing.
One would have expected that, you know, they will do better.
Yeah, well,
but when you look at in terms of, you know, crowd control and all that, you know, we're doing it now. We're a democratic society, a democratic country now. So everything that will be done, either by law enforcement or by anybody, it has to be in accordance with the laws of this country. So definitely, with the security sector reform, I believe all these things will be addressed.
There is room for improvement.
Absolutely.
Yeah. So Gambia moves to enforce fuel quality standards. Probably this is connected to low fuel quality that was circulating few months back, and I think the issue was addressed swiftly, and you know, everything returned to normal.
Which paper was that?
When they said some of the fuels were contaminated at some point. This is the Point newspaper.
Okay.
Yeah, because I think I saw this on the newspaper last week, but I don't know actually what steps have government taken there. You know, I can go in detail, you know, to that. But all I know is there was this lab that was set up by a private individual, you know, for testing fuel quality, and you know, which is good, you know, just like any other product that we use or consume in this country.
This is a sector that should be controlled.
Yeah, definitely. Yeah,
because a lot of things can happen because it is highly in demand. Yes. So the IEC warns against double registration as it rules out 2026 voter registration. Yeah.
Yes.
So
because these are things that happen. But I believe IEC, I saw this story. When I saw it, I was like, okay, you should tell us when people do double registration, what will happen. You know, maybe in the story, maybe later in the story that was mentioned, because the headline usually will not capture all that. Because I believe they have a system where they can detect if Balde registers in Lamen and he comes again and register in Latrikunda, the system should be able to flag that.
Right.
You know, to say you've registered already in Lamen, unless if you're moving to Latrikunda, then they will deregister you from Lamen and now register you for Latrikunda. In my own case, I registered in 2021 in Basse. But this year, because I will not have time to go to Basse and vote, so I want to register in Talinding. And if I go there, I will tell them I registered in Basse. I still have my voter's card, it's still valid. But because now I am going to be voting here, I want to register here. So I expect
them to cancel.
Yeah, to register me from Basse Kabakama and then register me in Talinding. So I think this is a system that IEC should have in place.
Absolutely.
You know?
So it all boils down to what we were talking about earlier on, which is digitalization.
Absolutely.
If you have the necessary infrastructure in place, you should be able to detect these things very easily. You know, because all the details of individuals are there. If you have Ibrahim Balde, we have hundreds of Ibrahim Baldes in the country, but the details are different, where they are born, their age, their height, and all that, everything is different. So you should be able to flag to know that Ibrahim has registered in this place, so he cannot register. Same as the you know, birth certificate registration. You know, now that it has been digitalized, once your details are there, the moment they click put in my details, automatically everything comes out. My birth certificate will come, my parents, that of the information of my parents as well. So I think we need this digitalization. We really need to move away from this manual way of doing
so
things.
I see the chairman did mention that, you know, they are moving towards digitalizing things. He even mentioned, you know, having big screens now that they're going to display outside all the regional offices. As the results come in, people will see, you know, all these things. So I believe, you know, these are things that IEC will definitely factor, or these are systems that they have in place, because if that's not it, then you're encouraging which means people can vote twice. You can go to Talinding and vote, come to Kairaba Avenue and vote.
So one thing I know, if you see they are highlighting this now, I mean, they are putting it into consideration. They are making sure, I mean, there is no double registration.
I think you should invite them and engage them more on this.
Yes.
Definitely.
It's
this is really a concern.
Especially what to do and all of that. I feel like, you know, even with the sensitization that is going on, a lot of people are out there who are yet to register, and the deadline is fast approaching. So people need to go out and register.
Absolutely, because, you know, your vote is your voice.
It's your voice.
So all this complaining you're doing, whether you want the government to continue or you want a new government, you want a system change, National Assembly is coming. This time around, we see the election cycle, all is close. From presidential, in less than 3 months, you go to the National Assembly elections. In less than 2 months, you go to the local government elections. So all this is important for a citizen to take part in the electoral process of your country, the decision making of your country. This is your voice.
These are your civic duties.
If you are 18 out there, you're watching, you are 18 and above, go get a voter's card.
And people should do away with the saying, okay, me, I'll not vote, because at the end of the time, it's not going to benefit me. I mean, it's your right to go and cast that vote, because you never know. So if you don't vote, you don't have any right to talk about anything in this country. Absolutely. Just be quiet. So let's deal with this story on the Observer 24. The government suspends non-essential foreign travels to public officials.
Yeah, I saw that. I saw that, and non-essential travels. Okay, so let's look at it in this way. So what is considered to be essential? You know, when I saw it, that was what I said. But after, when I read the press release entirely, I saw, okay, there is something to justify it, because they are saying it's the office of the president that will decide what is actually essential or not. And they also sent a directive to the Director General of the Gambia Immigration Department to say, if any civil servant to leave this country, they need to have a letter from the office of the president. So if you go to the airport, like say Julde is the permanent secretary, you go to the airport, the immigration officer will be like, where's your approval letter if it's not there? But anyway, looking at the world globally, we are in a crisis, energy crisis, serious energy crisis. And when we are in energy crisis, it does not just affect the energy itself, but it affects everything globally. Because when you look at what we do on a daily basis, it's energy. You know, we use the fuel, the electricity. We've seen NAWEC recently. Even though they debunked that they're in a crisis, but they said they have an issue, a situation, they're in a situation. I don't know how they describe that anyway, but
my people.
Yeah, looking at that, there are problems, you know. The fuel energy is not coming. You don't have electricity. It starts affecting businesses.
You know, once businesses are affected.
Yeah, for government, when crises arise, all they can do is to put in some of these measures to see how best they can, you know, limit their spending, you know, on certain areas and spend wisely. You know, look at the little resources we have, see how best we can spend them into areas that will actually benefit
the country. Obviously, non-essential travels, it should not. I think it should be banned completely. You know, seeing a lot of.
But you know, as a government, there are certain things definitely you have to travel.
You have that are the essential ones.
That
is
so here,
non-essential.
So non-essential
are banned. If it's not
important,
you should ban it.
Non-essentials are banned. No, they are banned
forever.
No, they are banned.
You see a lot of, you know, something happening at a conference, and you see all these people going, ministers, permanent secretaries, Gambian.
So here, what they are trying to put across, there are things that you know you don't need to travel. Now we have Zoom. COVID-19 have made it possible that we can conduct our meetings via Zoom. So I think.
And I saw this in I don't know, I can't remember which country it is, but I saw it yesterday. It's an African country. So they banned government officials from using V8 vehicles during this period.
They consume a lot.
Yeah, a lot of fuel because they have fuel crisis. So we've seen all Africa, all the countries are having this. You know, Senegal and Gambia ban non-essential travels. Senegal did it, and later the Gambia also.
Should start banning.
But I can't remember which country exactly, but they ban all government officials from using V8.
Start using Golf Type 4 for ministers
or Benz. You know.
Yeah, so that is it. Bala, thank you very much for reviewing the stories with us. We'll allow you to go take your coffee now.
Absolutely.
Oh, you don't take coffee, you take tea.
I take tea and coffee sometimes. When I went to China, I had to flip a little bit. But it's more of tea,
Green tea.
Yeah, but it's a cappuccino.
Cappuccino.
Julian knows the cappuccino.
Yeah, but nice one.
Cappuccino, yeah. So viewers, this is all we have for the newspaper review. And now we will take a short break. After the break, the program is going to continue. Thank you very much for joining us. And of course, now let's head to the other segment of this program. American medical team set to arrive for free health care outreach. And we have Reverend Bidwell Mendy, program coordinator. It's good to have you, Reverend.
Thank you.
How are you? How have you been?
I'm doing well.
I hope the team is reaching Basse this time.
There will be a likelihood in the future, not now.
Or you can just get me 5 of them, and I'll go with them to Basse. We'll do our own outfit there.
I think based on your persistence, I think I need to discuss with the team leader. Because actually she's my friend.
Okay.
And maybe she'll be able to either dispatch a small number, because GHO is involved in about 78 countries around the globe.
Oh.
Okay.
They do come up to Morocco here.
Oh, really?
Yeah.
Wow, then
because that is the second largest medical organization to World Health.
Okay.
Wow, it's quite big.
That's interesting. So let's delve into the conversation.
Yeah.
Let's first know what's the purpose of this doc team arriving in the Gambia.
It's a couple of years since we met, because I normally go there every year for our religious conference. And I came across this doctor who belongs to a church I go to in a place called Newport, Tennessee. And they said, we do go around the globe to help the needy people medically. Can we try Gambia? I said, of course, you can come. And they tried, and we started in my village first. And that was where I have some hard questions. Why do you choose to go to your village? I said, no. You need to listen to Jaliba when he's playing sometimes. Jaliba will tell you, before you take care of something outside, take care of the inside. When I say this, everybody laughed, but I meant it. And from Marrakech, we came to Sukuta. Then another time, we had to hold one at a New Life School here. Also Glory Baptist by the stadium. Glory Baptist by the prison in Joshua. And looking at the size and the congestion, we felt, why don't we also take it to Brikama? And that is where the issue of Jamisa Primary School came into being. And that is why we have been holding for the past, I think, two times. This is going to be the third time.
Okay, at Jamisa.
Yeah. And it's to be able to meet the needs of the people. And sometimes when you listen to people, said, Pastor, Momole Kuranta Gambia. You understand what I'm saying? Not everybody is sick, but you have the majority that are sick. And they are unable to go to the hospital, considering the financial constraints. And that is why I feel that there is a need. I was excited when I was told that, can we make it twice a year? And I think that is, if it works, that is proper for the nation. Yeah.
So how many of them are we expecting in the country, and when is their arrival?
There are 36 medical personnel
36.
arriving tomorrow with us in Brussels by 6:30. And that is why some of their friends and the well-wishers will be with us at the airport. Yeah.
So how long are they expected to be in the country?
As they arrive on Friday, the work starts on Monday to Friday.
5 days.
Yeah, 5 days.
So in that case, what are the specific medical needs that they are going to attend to?
Because it's a team, but a team of different profession. Ophthalmologists, dentists, cardiologists, therapists. And some of them are general practitioners, especially their team leader, because I've been to their hospitals and I see what they do there, in the US there.
Okay.
And that is why sometimes it's difficult for them to find their way out of the US, because you just look at the vacuum or the vacancy they will create when you leave for Africa, probably for 10 days, and the kind of work you would have missed in the office.
Yeah. So who is eligible? To receive this treatment?
Everybody who is sick. And I'm sure when you go there with the kind of your disease, you will meet somebody in the team who is in that area. Yeah.
Wow, that is quite interesting. But are they also giving priority to those that have chronic illnesses?
Oh yeah, that is where this idea of intervening with external treatment, that is like helping some people to go to India for surgery. You know, with Americans, hence they are not bringing their equipment here. They won't lay their hand on anybody. They can only dispense the tablets and also give advice as to what to do. And if it can be done internally and only to the expenses, sometimes they do come in to help. Yeah.
So they brought with them all their medication, medicine, and all the equipment.
I tell you, some of the medicine, if they were to sell here, not many can buy.
So what is going to be the admission process? The registration process. Are you registered in prior?
No, what happened is we do it locally. Because if you feel you should do it prior, you may create a lot of hindrances. And that is why it becomes like, who goes early stands on a line. And based on that line, they would start calling people registration number, and that is the number you will use. And at the back of the card, they will tell you to go to where you told them. If it's eye, you go to the eye unit. If it is teeth, you go to teeth area. If it is maybe body, they call it medical. That's where you go. Then you meet all these people. Now, sometimes some people's disease are like psychological. And you have some of psychologists coming with them.
Okay.
Yes.
So can a person benefit from, for instance, I want to check my eyes to see if everything is fine, my teeth, I need to do dental cleaning and all of that. Does it allow you to do 1 or 2 medical?
Yeah, sometimes it is possible, but sometimes they refer you to come the next day because of, the place is overcrowded. And that is why I do request for security personnel, sometimes up to 8 of them. Because sometimes people want to use like Kumun Samarum Duma. You understand? And I said, no, you don't do that. There should be that orderliness. Because when there is chaos, these people, they can easily get scared and they will stop.
Yeah.
Okay.
They will stop.
All right. I know people are watching and they're like, okay, let me call. I mean, he's on TV. Let me call him.
Let me call
That's
him.
how our Fulani people. Yes, but it's all right. That's normal.
Normal.
It happens. It happens time to
right.
time. So let's move on.
Partnership.
Yes. With
Are they
yes.
in any partnership with our local
Yes.
doctors here?
That is what we are finding. Coincidentally, I think my brother-in-law is heading some unit, and I would rather call him to come to the ground
Okay.
and meet the team, because I don't want us to miss this opportunity. Many countries wish to have this. And with my presence in the US every year, other churches may want to join them and get their doctors get involved, which is going to be a larger scale for this country. And that is why I said, let us just know how to handle them so that it will become like a bond between Gambia
Yes.
and GHO.
Yes. And create that.
Oh yeah.
Yes.
Oh yeah. And that's where this idea of your wish
Yes.
to probably have your
Yes,
people.
yes,
I mean, it's possible.
It
because
can happen.
I do hear from other people say, no, Pastor, we can provide our own car to just have these people go to attend to our people.
Absolutely.
Yeah.
We have a lot of medical.
I wish some of you are on ground at the treatment place and just look at the kind of impact.
I think I've attended one.
At
Yeah.
is that by the stadium?
No, no.
Oh, by the prisons?
Yes.
Yes. Yeah.
Yeah. I attended
Yeah,
that
yeah.
one. Yes.
So
I was
let's
there and I had
localize
my
this. Yes.
dental
Let's
cleaning and
localize
all
this.
that. Yeah.
Julde, let's do this in Mandinka.
Right.
Reverend, mol laftale ye domandin for mol ye nying luntangol melkana munemu ila singoti Gambia banko kanja.
Yes, ko nga fo nyami nyine be kele ile si nyaworo njangoti kana Gambia jang.
Okay.
Watu mene nata folofolo nge samba marakisa mbote jenta ta sukuta ila na fulan jango ngamra nata Westfield jane New Life School na treatment keje. Another one nga ke Stadium bala Glory Baptist School, and the other Glory Baptist School mimbe Joshua. Now it's called momo mi ulita juna drong je waleng ni tata yela place o nyini yesi yela moy inyanta minkela ani manyana minkela ibe kaito dilera wo kaito wole ba tan le inyanta tala dami ani nyanta sila dami ani docteur mi nyanta topotola ha wole ga kuwo so ne andi but wala tan fanam because mol la siya kama and sometimes mol buke famarano is a program o tiñano wala nan wadi don ka police or sama nan pour ye mol makoy bari kabiring na dati fo bi nene man problème o soto no anu mawdu afam ka to nyilun tangol ni nate kam manyale jibe nyinu da nga continue kana nyim banko to bang o ngam fonyo ka to afele sa nyim masibo keta anu mandua wala fam mal la fi wala because mo jamal kanyin kalen ko to lego even though it is abena do ko batandikang because it is like you are not focusing on your profession. You understand what I'm saying? Yeah, therefore, if we are doing it, let us do it decently. Isaje mo jamal sinano. Minu solata. Hadi.
San doctorol nga diamu doctorol la fanala. Doctor jelle kana ani ila doctor isi fanya din kada because last year tanga understand ne dol bi jelle kana pour nyingol dol ha nyingol topoto dol nya dol kabalu topoto and all that. Nyinan dum fo mbo si fa fana
imo tan sabani woro lom and wo mo tan saboni woro minu be nya topoto kan wol bijele minu kan nyingo topoto wol bije minu yemi lon ko choko like therapist ika wol be konole and you also have psychologists yemi lon ko sometimes kurando buka ke kurangote bari danko mo se diam ni dron ase le lod lalon ase ya marino inyanta minkela puri kan ni otora anu iman kuran wol be bijele hade
so nying support nying ni mo lafta tala je wala kama be abekala nyaden
ya ko nga fale nyamin ani angale kan just wuli juno dron anin ta juno ni tata juna ni tata mole ba fole go nyanta sila dami anu ilo sio wole be la kayto soto so ni and lebulo pour ni ya dire sa fo e nyanta tala dami anin docteur e nyanta min min fenkela inyanta min jela
China-
kadu e kaminke ni mol sita foka o watoro doctor o kana sometimes mol ka ke fengo ti ka ke koronto kuoti isaje ka kidi tuba wol kan nko to no ali si drong ali si al noto yena tiketo di alla isa itande atolla al nyanta tala dame
Okay.
So,
Yeah, the location.
yeah, Jamisa Primary School.
Okay.
Jamisa Primary School. Ni ta da gunjur ni Jamisa silo denta dame. Ite ka je jambanjel silo leta. Yetambi this Methodist project la. Yeta ibulu maral ha. Yeta ibulu marala. Silandingo le bije ikadu je. Bari molla si afango. Wo batena fa ibaje la muni umbita ni simola kada.
Ibalon na la be dame. Say muntu male nying
Jaro nyanta datila kabo tenengo fo arjumo.
Tenengo menkana.
Ha. Atili tanni sabakata atili tanni worola.
Okay. All right. That's very interesting. I mean, thank you very much. Mbokk yi comme nuñ leen ko waxee comme lu moo wax nii mooy dañ am ay gan. Gan yuy ñëw yu bàyyi ko America ñëw fii pour joxe free treatment. It's free, right?
Yes.
Okay. So free treatment Jamisa Primary School la moo nekk Brikama. Te altine la moo door su soobee yàlla.
Si suba.
Waaw si suba kon ñëpp nañ try ñu nekk fa. I hope you'll be able to contain the amount of people, the number of people.
Usually, how many
that is why we prefer that place because it's wide compared to previous places that we have been using. They are too tight.
Yeah.
And you see, when there's a space, you can easily allocate people a place where they can stay.
Yes.
Those who are treated and those who are yet to be treated.
Okay.
Very, very easy.
Thank you. Thank you so, Reverend. We've already exhausted this time already. And we wish you and the team best of luck.
Thank you.
And please take care of our guests very well because we want them to be coming all the time.
Thank you.
Yeah, so viewers, this is all we have for you for this segment. We'll be right back after the break. This is QTV This Morning. I am Ibrahim Abalde. Thank you very much for joining us. And now we have Mr. Tijan Jallo, Director of Operations MCA, and of course, Maria Masimaha, Director Registration and Evaluation MCA. Gentlemen and lady, it's good to have you on this program. It's good to, have the MCA here.
Thank you very much.
A lot of questions to answer.
Thank you very much. And we are also glad to be here, and MCA is for the Gambian people. Whatever MCA does is just towards safeguarding the general public.
Yes.
Okay. Thank you very much. It's a pleasure having us here, and we are open for discussion. Yeah.
Yeah, so let's talk about let's open with the role of the MCA for a first-time viewer. Who've been hearing MCA. Although we have MCA here as a QCell service, missed call alert service, the MCA. So once I hear MCA, that's what rings in my mind. Yes, but this one is a different one. So let's talk about the role as far as the healthcare system of the Gambia is concerned.
Thank you very much. MCA, Medicine Control Agency, is the body that is surely responsible to ensure that any medicine that is coming into this country is of high quality, safe and efficacious, with the sole mandate to ensure we control and regulate manufacturing, advertisement, distribution, registration of medicines and related products. The related product cut across from medical devices, cosmetics, the list continues to ensure that whatever our Gambian populations are using is of high quality. It is also safe, it is also efficacious, which is geared towards safeguarding the general public. And the Medicines and Related Product Act 2014 established the Medicine Control Agency, because to be in line with both regional, continental, and global best practice, the legislative framework deemed it is a necessity to establish the National Medicine Regulatory Authority. And in the context of the Gambia here is the Medicine Control Agency. So to cut it short, that's about MCA. We have various kinds of roles which cut across, which we will discuss, maybe based on the question that you asked. So we are mandated to do a lot of things to protect all of us, including ourselves and the loved ones within the nuclear and crown of this country. Thank you.
So in that case, Mariama, can you walk us through the registration process of medicines before they are actually approved for use in the country?
Okay, thank you very much. Registration of medicines or related products is very important because you can establish the safety, efficacy, and quality of medicines through registration, because there are processes and procedures in place that ascertain those qualities. First of all, registration entails there are requirements that the applicant has to meet. Like any medicine you see is manufactured, and when it is manufactured, all the processes, it is written down in a dossier. So that dossier, that's what the manufacturers, they submit to regulatory authorities for registration of that product. So from raw materials to finished pharmaceutical product, everything is written down. So when an applicant submits medicines or related product for registration, you need to submit that dossier. The dossier of the product needs to be submitted. That needs to be in a CTD format, which is universal, international standard. And you also need to fill application form. We have the application form on our website. That is application form for marketing authorizations of medicines and related products. That form needs to be filled. You need to also write a cover letter, and together with a commercial pack size of 3 samples of the product you intend to register. You also need to submit registration fee. There are fees that the applicant needs to submit, needs to pay to the agency for the processing of the registration, because it goes through assessment procedures, which the dossier, that is the document of the product, is assessed by our technical officers that go through it. So that processing fee also needs to be paid by the applicant. So if all those requirements are met, what we do is we assess the product. The sample you submit together with the document, that's the dossier. You have to assess all the part of the dossier from module 1 to module 5. If you are satisfied with all the informations that are submitted, then you come with your recommendations. Sometimes you can come with recommendations or queries that you need to submit to the applicants to fulfill. And if all those things are met, then we sit as a registration committee meeting where experts, myself and Executive Director of the Medicines Control Agency, Tijan, Director of Operations, and our colleagues, we sit as a committee to give to make a decision on the product. That depends on the assessment report we receive from the assessor, and we can make decision from that. So from dossier evaluation, registration, from dossier evaluation, you have to do quality control testing of the product, because registration entails quality control testing of the product to ascertain the quality of the product and to know whether what they claim this product has, whether it has that actually. And that can only be ascertained through quality control testing. And the third component of registration is good manufacturing practice inspection. That's GMP inspection, where they manufacture the product. The team has to go there. The team MCA inspectors has to go to the manufacturing site to inspect the place, to see whether it is according to international standards. Yes. So it entails dossier evaluation, GMP inspection, and quality control testing. All these 3 procedures and processes entails registration to ascertain the quality of the product.
The quality testing process, those that include the laboratory testing?
Exactly, that is quality control testing. Yes. Yeah.
So do we have that capacity, that enough capacity as a control agency to test some of these things to establish the quality and the safety
Okay, let me come in. First of all, just to add on to what my colleague said pertaining to registration. It worth noting, MCA staff don't work based on our own discretion. Whatever we are doing, it need to be strictly be in line with the confinement of the law. Section 25, subsection 3 clearly indicated prior to registration of product, the agency should go and do GMP inspection. Or if the product comes prior to registration, we need to subject all the products to quality control testing to establish the various key test parameters as per claim by the manufacturer. And if we look at some of the parameters that they put there, we deem it is not sufficient, we will also request them to do further testing to ensure whatever is coming here is of high quality, safe, and efficacious. Now, coming back to your question, whether we have the capacity, of course, MCA have human capital. Having the human resource is there, but human capital, people with the experience, with the requisite knowledge, and with the competency. Resources we know are scarce, but we maximize the scarce resources that we have. After the post-unfortunate AKI that the entire country is still mourning, we come up with mechanisms to ensure that, like, we put a lot of mechanism prior to importation of any medicines coming into this country, especially for product coming from non-SRA, non-stringent regulatory authority as per WHO. MCA experts left our comfort zone. We went to those countries because we did our survey and we know over 90 to 95% where the medicine that comes into the country that we use, we consume here, is manufactured in those countries.
Should we mention India?
I don't like mentioning countries, but as you want us to be specific, yes, we went to China, we went to India, we went to Pakistan, and also, of course, within the region here, we also went to Ghana, because there are products also coming from Ghana. So what we did, we went and audited labs. We are not reinventing the wheel, because after the unfortunate...
Was this done after the AKI incident? Or
that's why I say post.
Okay.
Post means after the AKI, right? We put mechanisms, because those products that came, all the test parameters that were there was okay.
Yeah.
But there were certain parameters that those products were not subjected to, which was the residual solvents.
Why was that?
Those residual solvents are the ethylene and diethylene glycol. And as per compendial, there are certain acceptable criteria limit that are clearly written in compendials. But in laboratory testing, it's worth noting there are certain parameters. You have to do 3 different kinds of identification tests. Then from there, you establish the content of the product. For an example, if you manufacture a paracetamol and you use the British pharmacopoeia, the acceptable limit is between 95% to 105. So if the product is tested, it's having 94.99, still now the product is what? Substandard. Meaning the product, the claim active pharmaceutical ingredient, which is the API, is there, but as per the compendia that they use to manufacture it, it did not fulfill what? That requirement. If it is above 105 even with 0.1, it is also out of spec. So that's what, as per WHO, that's what they call what? Substandard product.
Okay.
So what happened when a product has been found to be substandard? And also, how is it done? Do you allow in an entire consignment of medicine to come in and then you just pick and test? Or you just allow few to come in, samples, test, and before you allow it to come in the country in the first place? How is it done?
Thank you. Just to continue from where I stopped.
Yeah.
If the product meet those things, but it worth noting, before the product comes into the country, we put mechanisms. And we audited labs that are ISO 17025 2017, and they are also WHO pre-qualified labs. And those labs are also approved by WHO. So MCA is not reinventing the wheel. We put mechanisms. Now, we went to those places. We have third party that we signed a service level agreement and also memorandum of understanding. So we put certain parameters that, first of all, the manufacturer or the distributor or the exporter must first fulfill even before the product is sampled to be sent to those labs. We did not just focus on only the lab, but we also think about our own Gambian population, because we went there, we negotiated with the labs concerning the prices of testing. Using one country in Africa here, for example, Ghana, if we are testing one syrup, one batch, it costs $1,500 to test one. But now we went to those countries, we negotiated. Let's say for India, if we are testing a similar thing, the lab, we negotiated with them because we know any price that the manufacturer pay or the exporter or the distributor, the person is going to spread it. And the importer, whether public or private or NGO, they are the one importing, they are going to spread the cost, right? So we negotiated with them so that the price will be what? Minimal, right? Without undermining what? The competency of what they are doing. So now the product will be registered for. Some of the key things we put there, the product have to be registered. It need to have certificate of pharmaceutical product, certificate of analysis, good manufacturing practice certificates, and other parameters, right? If that one is done, that's the time our third party, it's not the people working in the lab directly that will go and sample the product. Because we put in mechanisms, even though those labs and third parties are also audited by international partners as well. But just to minimize the risks, because risks cannot be fully eradicated, but it can be minimized, even our own individual homes. So now those people will go to the facilities. If, let's say, an importer intend to bring or the government intend to bring, they reach out to them. First of all, those people need to apply to those parties and copy MCA. And they need to provide all those documents, the product is registered and this and this, with all the parameters, evidence. Then from there, those people will go to the manufacturing plant and witness the loading of the container. If they are to stock the container now, any product that they take, they have to snap. If it is the primary, if I say primary packaging, let's say you have a small box of Prastamol where you put the strip. So the one that directly touch in contact with the tablet, right, is the primary packaging. They will snap that both back and front. And also the small pack where it goes in, which is the secondary packaging, they will snap that, including all the boxes where they put them. And they will snap the container and they will load it and stock it. When they are done with everything, they will seal that container and they put a coat. Now, put a coat.
Then this is a very complicated and complex.
Yes, but now we put the lens of a regulator is always putting the interest of the population first, which is geared towards quality, safety, and efficacy. So if they do that, that's the time those people will also package them, because we already put the quantity that they should collect. Then they will send it to the lab. So we did not just sit and allow the lab also to do those 3 tests that I told you, right? We also condition them. Any syrup coming, they have to check what? For the related substances, where this EG and DEG is direct. They must test it.
So the thing is here, we have exhausted the time. And you know, Director, we should, for MCA, we should have at least an hour, not just 30 minutes. I think it's, because we wanted to talk about that registration. I learned that now when you are to register, you have to register in dollars. You know, and can you delve into that quickly before we close this segment?
Why in dollars? Because those fees are meant to be paid. They need to be paid by the manufacturers, those who own the product. That is the medicines. The manufacturer or the marketing authorization holder. So if I say marketing authorization, an entity that has been authorized to market that product in a certain place or country. So they are meant to be paid by those manufacturers and marketing authorization holders. And those are foreign based. They are not Gambians, right? They own the products, so they pay in foreign currency, and that is in dollars. And also, why in dollars? This is international best practice. our sister regulatory agencies in Africa, worldwide, they pay in dollars. Ghana, Nigeria, and others, they pay in US dollars.
Yeah.
Yeah, they don't pay in dollars. It's not the applicant or the local agent that's supposed to pay for the product registration. It's the marketing authorization holder and the manufacturer that's supposed to pay it. Yeah.
Okay, so thank you very much.
Maybe just to add on to that too.
Yes, quickly, we have
I
exhausted
think my
this time.
colleague, you see, is always, when we come here, you are always calling us on our neck. And we are here to clear all the shadow of doubts for the Gambian population.
True.
So if we come, we are just giving like a time that we feel like we are imprisoned.
MCA, now
we are always fast-tracking. Now, going back to the
Yes.
question, it's important globally, as per WHO, people use hard currencies.
Yes.
Because the raw materials, which is the excipients,
Yes.
or whether the intermediate product, the bulk product, and the finished product coming from manufacturers, right? All of them are paid in what? Dollars. And we know currencies are not stable.
Absolutely.
So now, also for regulatory compliance, Gambia, we are not reinventing the wheel. My colleague already made it clear. Now, with the advancement of technology, things have been very transparent.
True.
Other countries too are doing the same thing, even though they have their own local currency. It's only when it is manufactured in country, and we can all attest to that right now. We don't have any approved manufacturing company in the Gambia dealing with vaccines, blood products.
That is true.
But now, if our own people...
Yes.
Cosmetics we have.
Yes.
Now, let me come to the cosmetics.
But you know,
If you say-
I am just afraid the time is...
I think we should...
Okay, so
explain it
director
and
said
have
we
them
can give
again.
you 2 minutes. Yes, let's
Thank you very much. So, coming back to the cosmetics, it is still under the mandate of the law.
Okay.
And the law clearly indicated, and I'm happy that my sister is even holding this.
Oh, yeah. Okay.
We want transparency. When it comes to regulatory body, everything is transparency. You see this book?
It's
It
approved.
is something that is gazetted by
gazetted.
government. This is what we use. MCA, we are not working based on our discretions.
Okay.
Whatever we are doing need to be strictly in line with the law and the subsidiary law. And we have these fees also in our website. This is just the medicines-related product fees and fines.
Okay.
Regulation 2023. We have it on our website. We also have it. It is available to all our stakeholders.
Okay.
But if entities or stakeholders within the country want to take up the responsibility for the manufacturers or for the distributors, and they pay on their behalf, they pay in what? It's dollars. They will be reimbursed. It's based on their agreement,
Yes.
which we cannot control. Coming back to the cosmetics, so my sister did claim there is an approved manufacturing company for cosmetic in the country.
In the Gambia?
It's important.
I don't say it's approved. What I'm saying that you have people
Manufacturing.
That's,
even on social media.
No, let me come. So it's important if you say social media and approved legal media houses. The reason why we are here is about, most of the time, it's about the credibility and the integrity.
Absolutely.
People are entitled to their opinion, and people are entitled to say whatever they want. But MCA is a public institution. It is there for everyone in the country. MCA is open to everyone. We are there to guide people. We are not there to cripple people. Gambians, we are all one. Coming back to the fees, if you are talking about cosmetic, let me just cut this thing short.
Yes, quickly.
Right? As my colleague said, let's say cosmetic registration, let's say is $100. That $100 is for 5 years, meaning each year you are paying only what? $20. And that $20, even if we take the dollar to be 75, is 1,500. That 1,500, you can bring as much as you want of that cosmetic for the entire
Valid.
5 years.
Wow.
So if you can bring 40 food containers, you can bring 100 containers, it's up to you. Your buying capacity.
Yes.
So let's all be candid and call a spade a spade. If you are paying, let's say, $20 per annum, but you have to pay the $100 for the 5 years.
For the 5 years, yes.
If you can bring 100 containers, million containers, it's based on your capacity. And that one is after the 5 years, then you renew.
Okay.
It's not MCA that is setting this. This is global best practice. MCA is not reinventing the wheel.
Okay, okay. Now we know. Thank you very much, Mr. Jallo and Simaha for coming. Whenever we inviting MCA here again, we should give them an hour.
Yeah,
not 30
minutes.
minutes.
A lot of things that need to be.
Oh, I mean, director just informed me that you are coming on Kachadula, on one of our programs. Yeah. So I think that you would have more time to, yes. Yeah, so viewers, we'll take a short break. After the break, then the last segment of this program, we'll be back. This is QTV This Morning. I am Ibrahima Balde. Now let's move on to the last segment of this program. Heat alert, public urge to stay hydrated as temperatures rise. We have Lamin MN Dabo, Health Communication Officer, Directorate of Health Promotion and Education. It's good to have you, Mr. Dabo.
Thank you. I'm glad to be here today. And it is important we come here and discuss about issue that
Mr. Dabo, this I would love us to do in the local language, in Mandinka.
Okay.
Yes, because yalo na mol fanang.
Exactly.
Ika kebaje abeta mala tilo koto drong.
Bake.
Abuga jioming amang kulonje. So important tale pour nga nying kacha laftale drong muna na al nying simfa wulta pour ka fo mole ko al nyinke pour ka balol tanka.
Baraka bake Mr. Balde akumaya batale ni nyontumol be kering. Because hit mu fenneti kandolem kandilana tambirngolem mi alon ko aka hadmadungo batandino bake surtout nana tala jara kende so akumata because at wabul safaji molle bije mi alon ko dia at high risk wala multi mi alon ko nying hit sol batandino bake so ni nata wala maybe dinnol bol konole dinanol bol konole alfal bije le mi alon ko nyi sasal bela sukur courantol hypertension wala mu yele sele courant wolti ani ñu courant dol so mu fenete mi alan ka kuma badal so no fananketa nke remedi min fo mole wala ya kata bake e karim because mu fenete mi alan ka kuma badal hanata manke ñi tumodi ñi situation mi alan ba kono mi mu fenete mi alan ka kuma badal so balo e fenenit mi alan ko ay temperature ñi mi alan ko nyanta kulal wala balo ma ñana kala na tambi kandoke because nala tambi candidate organ so nin ben kono ake affect nol. So because ne hidje because na post on minke Ministry of Health pejodo na meeting dije wolam ñing hit ñi asi minke no wolam asi hit exhaustion wala lena tambi taro fana ko keno comme yetta foy defal nako bari mbuka interasi fakel so ako fana keno andum fana aka sa tinano fana nyamino ko keno le balakando kundimo andol bije fan wolsi ake bondino exactly so ne ajibe fa dol bije ko wala ka fa nimbe mol kono surtout mototiyol mi yalan ko e be trafic ko kono wol fana gol molet mi yalan ka ke affect because nanta ko wol fana sorale jela wala mol mi yalan ko e be trafic ko kono police mobile police ko sali fana kam tilo ko do bakel anu fana wafir la min katara street ol kan adum fana mol mi yalan ko e be construction dokulal because fana molete min yalan ko katara tilo
mol melka doko ke tilo koto
exactly so molete min yalan ko
hanata serekunda musu wafilal fa melka si tilo koto
exactly so molete min yalan ko wol fana nyanta ke yamar nyinela wala mi yakata bake hanata because atwa wol fon savudi if you must work outside comme nata la doko ya dimana pour y doko ke banta wala tilo koto nyanta minkela do wato wati e kari il fonyondi comme ça nin time botal do ye fonyondi yeta diben koto wala fanan ye jiumuta jiyo tare bala because ñing hit wave nabe kering WHO dunya la jata kende abunda ba e specific amount of water nana wala quantity of water mo nyanta kamim because because mol ka tarale differently dol bi je man trastilo ko bar han sang ñi kando ke mala exactly so dol bi je fanan ela body weight fanan aka contribute nyana ka jiyo mi so en kam advice wala e mari yakata bake ye jiyo mi so nin ko ye jiyo mi fanan so ma fo lana tambi jimi so wala maybe every 1 hour isi kopotano la yo exactly ñi kopo kayno biya ya mi
okay
isa jele be ela body la temperature be cool
fani moye jio mi mbake o ka ake mantoral
ka fole overhydration ako fanan ka kino comme ça ye jio lana tambi sur sunkaro kono si se kunan ko ni kama kono exactly fa lana tambi bul so ako fanan kino so be min follow don but yala nyin kopo ni amin like for example every 1 hour or every 1.5 hour ye mingo o te batandi ba so fenete mi yala ka kumar an dinwol fana nyanda hakilu lol to bakel yala ka bi nga start ko min yala ko wolle be hyrix wala dindingol so dinwol wardo bi ni be feala itol ka nyinal
wol buga fo no mbe min
exactly mbe minnale wala min do be nala fa itol katara feala dron so itelem alfa mi yala ko nyanda hakilu lela ko to ba ye monitor maybe jandi be findle ta feala ye jiyo dile yemin ni tata feala fanan ni be feya kono jifa si kumanula alnana ni nata ye jiyo dile yemin ani ni pede feala fanan isi jiyo fanan dilol yemin fanan fene mi anga kumade
bari ni ko jiyo because nimol nin kando be kering nimol ko jiyo jama ka jus male fenkede wala galaso
aha fanan be yatal ba kadu ndaka tiara jus min bakele ko
so ninko jiyo jiyo ni tambo min to den jisma kumada pour moi mi kana lanne tami sumayak so nimba fala ngavel cool wara kana ka jikando ha go sibaje le ne jiyo mi alan ko ala temperature kayanta wala asla sumaya kayanta o be la temperature talanu la niami so andum fanan ke wal fanan bijela nyanta fanan diamu la wala mol mi alan ko ni underline conditional bela wala diabetics comme ça ngo fanan fo janne so mol nyante hakilu lawol to la because wol dol bije katara indos la all the time so min fanan be bungol kon so ko bungo dol bije wala ventilation man correct wala ila fonyo dundula man correct baake wala amang sia fon so ka bundoje dron bunda kilne bije wala palantir kilne bije fenti je correct so bungo fon kono ridole beje so ning hit kala don bungo kono kandi baake la so min hakilu tun na kebal to min alon ko e ban kenda be bungol kono ngakata be bungo min kono ni si fana kenoje wala natan si palantir wala nga bunda ele fonyo sumaya duy kan o fana fene mi ka kumada anu fana ngi makoy nka jiodile kali e min fana watni wat dilo ko non
nyin kando de ngamra do ko walende kando wa asiata bakele bari saying ning mo dehydrate e man jio min woka mune cause aka mune cause no hada ma dingo balo
yo o kumata le julle because ni man dehydrate any man hydrate o min cause no le asi heat stroke dinolal ñing fonko situation o mi ala ko mbako no andum fana ni baaje min do kemata because ni hydrator wala balo fota jiola jio mi ala ko a fota minna amo jio ka balo ko balo mo jio ni soto wala mbafla tuba ko la dran wala the body loses more fluid than it takes in
okay
so fenete mi ala ko o fana ka dehydration o sabla so no keda e mari simin fil wala dizziness nyamini ngo wato dol bije si ato dum fa hede soto wala kundi moti si balakando soto o fanan ka keno la mi alon ko ni dehydrate don ako si
bari ni ko fanan jio nga jio min mun ji si fala nyanta minna katu min fegol si atal de
bake yes
kunu sita jannen ko na mole ko ngam min fe jamal min
exactly
e ko ni ko ngam min fin na mol ko ni ngam min si fala min so mbalon na mune nyanta minna mun ji sifa hanna radio lam yalon jio pompo jio bije
exactly
you know bohol jiol fanam bije foka pare kolon jiol fanam bije
exactly
nyeng ji kabol fanam bije so mun ji sifa lam
so nka yamoro di mindi mon la wolem pompo jio mu jilade mi yalon ko because aka bona daminto aka treat jel te wala ka treat meno kala bar boholo fanan nakata do kono nun ka fonu bohol sinasia baten banku kan ya so nka yamaro mindi molla wala na trebe boholo sinna andi ne asim fane bakala mentalde jandi be wakila do e be boholo sinna do ya min witati manta ya tes yalan ko jioni fa fitel pour ita mi wala fa fitel pour ya use pour kudol so sitano abuko labo bi jele mi yalan ko ika geotest isaji ele geotest nata be stage min to ba folene nata nitel pour ya chlorinate wala e fendo kala mi yalan ko aba sifla drong e bo folene so bari jembe min ka bo pompoto o seniyatale min ka bo kolonto o nyanta trial la nata wo damala bije because la do bije maybe wole kolon damala so mi yalon ko pour minta so nata wo damala bije fanan ka yamaro dile mi yalon ko soko surtout kolon mi yalon ka da baka bit yando bije bige la kolon da bit so ke yamare c'est la kolon da bit wo fanan niya bi yakate joni fajinde pour ibajal jans min bije fanan so talano back hanate ma completely me fa bari sa talano back so ani jio fanan min ka wafi fanan wol mi jio lelti mi yalon ko ka treat because helkata inspection wala jele kaje ko jioni ibe min deda kan aka jiti mi yalon ko abeta pour mo ya
so abarka bake thank you time woni bantale aka munta ko fenne me yalon ko akumayata bake.
Climate change is real
Ngaro nembe engagement jamal sotola.
Exactly.
Mbe kacha jamal sotola nyato ning ala sonta. Abarka bake Mr. Lamin Emen Dabo for coming on the program and mbe engage la in the future.
Thank you so much.
Yeah, so Julda, this is all we have for today.
Yeah, until we come your way next week
for
another edition of QTV
Yes,
this morning.
Thank you very much. I will be on the Ministry of Health program at 9 p.m. tonight. Until then, bye-bye.